want to maintain that weight-bearing line, not have it give in.
Got it.
Yeah.
Okay.
Uh-huh.
No, it makes sense. You just got to remember, cute, to do it.
To be aware, to
Yeah.
be mindful, right?
Yeah.
Yes. Yes. And here's the kicker, okay? To help prevent injury to the knee and perhaps arthritis also, you want to even out the forces, the weight-bearing forces on the knee so that it's as symmetrical as possible. This is not symmetrical, okay? This actually is a risk factor for tearing the meniscus as well as the anterior cruciate ligament within the knee.
Mm-hmm.
This action. It's kind of like the old football injury where someone tackles you and knocks the knee out and it creates pop, pop, pop. It tears ligaments, meniscus, as well as the ACL. So by gaining and maintaining this weight-bearing line, it helps to prevent a lot of injuries within the knee.
Mm-hmm. Okay.
Okay, good. But that also can apply to changing direction, like taking a lunge or a step off at another direction. So if I go obliquely, you can see I'm pointing in this direction
Yeah,
at an angle, but now I'm going to point my foot at you. And I'm still maintaining the weight-bearing line, as well as this knee. Ah,
that's not good.
weight-bearing line. Very good. And this is actually, you're applying a very fundamental concept to protecting your knee, as well as getting the musculature of your knee to naturally stay strong and even gain when you work within this alignment.
I think I'm okay there. Yeah, I think I'm pretty good with that line. I've never really concentrated on it, but I believe.
Excellent, good, good. So I'm glad to point this out to you because once you become aware of it and you examine yourself for it, if you detect that you're deviating, you correct it.
Right.
Okay.
Mm-hmm.
You help to prevent injury, and also the quad muscle, the quadriceps muscle, actually works better within this line. So it's good to be aware of it and to nurture it, create it, make it happen. Okay?
Mm-hmm.
So I was just reading an article 2 weekends ago about how the squatting movement, which incorporates the knee, is a good indicator of your quality of life, of whether you're going to stay independent for the rest of your life. Of course, there are other things involved with that too, but the squat is a physical indicator of your ability to stay independent, right?
Mm-hmm.
Because it's used in so many actions, getting and reaching down for something on the floor,
Mm-hmm.
sitting down.
Yeah, when I do squats, I try to push my butt back and so that my knees don't go over my toes. So,
Correct. Don't go beyond your toes.
Yeah.
Yes, very good. Okay. But now, here's the thing to think about, because those are the two things to think about are not to allow your patella, your kneecaps, to go forward to the toes when you sit down versus there. Okay. Right? That's what you've been talking about?
yeah.
Okay. But also, when you sit down, you're still pushing your hips back, your butt back. Also, make sure that you're not caving in. You're maintaining the weight-bearing line. Huh?
Yeah.
Yeah.
I'm pretty good
That's
like
the second
that.
element to pay attention to.
Yeah, I'm pretty good on that one.
So very good. So now this brings us to ubiquitous or everyday, applied to almost every motion that we're going to be doing through the day, okay, motion, which is the squat, sitting down and getting up. And you actually can repeat that. This is a wonderful exercise versus doing, like at the gym, a knee extension.
Yeah.
This can be very difficult or challenging for someone with kneecap patellar tracking problems and kneecap cartilage problems, patellar cartilage problems. We don't actually like to give this to people anymore, except under lesser weight.
Yeah. Let's see. So when you can see, right?
Yeah.
So I'm doing my
Closer.
Huh?
Let me come closer. Okay.
When I do my squats,
Yeah.
I mean, it's hard.
Yes.
Push
You
my
need to
butt.
lean forward more. Push your butt back more. There you go. Feel how that lines up your body weight over your feet?
Yeah.
Yeah.
Yeah, I try to do it without leaning forward. You know, I know it's hard to keep your balance, but
Yeah, you can. Well, you'll notice that you can't lean. You have to lean forward. Otherwise, your knees have to compensate by pushing forward to keep your weight over your feet.
no, yeah, it's trying to do everything at once. Meaning your butt back, your knees not over your toes,
Yeah.
and not leaning forward. So it's like you're like your balance is really hard. So.
Sorry, we lost your visual. We lost your visual.
Oh.
Sorry.
Sorry,
But you're right. Okay. So think about it this way. Okay. In squatting down, there we go. Got it. In squatting down to the floor, think of it as if you're sitting into your chair. Yeah.
Yeah.
As if you're sitting into your chair. Yeah. Except the chair isn't there and you're reaching to the floor to pick up something. See? Yeah.
And the other thing I try to do is line up my feet straight, like 12 and 6 kind of thing.
I'm sorry?
To line up the feet so they're 12 and 6. So they're
Correct. That's good. Ideally, that's what you want. But you also want to line up your knees to line up with the feet.
yeah. Let's see.
Good.
Push it down a little bit.
Yeah.
I'm squatting now.
Good. How does that feel to your knees?
It's fine.
Yeah. Good. If anything, the lower you go, the more your knees bend under your body weight. You'll notice your knees will tend to want to roll inward. So you have to be aware of that and compensate for that by pressing out the knees.
I think we're good.
Okay. Try pressing out your knees a little bit more as you get down. More. There you go. Good. More like that. How does that feel to you?
That feels fine.
Yeah. That's what you want. Huh?
It seems like I'm cheating now when I do that. Because I'm
Cheating?
off of my laser line.
Oh, no, you're not actually. You're compensating for the tendency to roll inward.
Oh, okay. So you're really kind of staying neutral?
Yes, exactly.
I mean, I can't look down. Yeah.
Well, yeah, you can. You'll see it. You actually will see it. You actually will see it. So that as
Okay.
you,
I see. Yeah, but now I feel they're yeah, I guess.
the tendency will be to do that.
Okay.
Subtle. If you really have to get down to something, to lift up something heavy, really get a widen your base of support, okay? And then line up the weight-bearing line, and then you do the same sitting squat action, except now you're fitting between your hips and your knees to reach down to grab something very heavy. And then you can use your
Get close.
to drive you up, protecting your knees at the same time.
Okay. Yeah, I'm happy.
Yeah, good. Okay. And what I find with people is that if anything, they tend to slightly roll in. And then they feel better when they press out again so that they can get back online that weight-bearing line.
Okay.
A clue to that is whether the arch in your foot starts to roll in.
Yeah, I think I can manage that.
Yeah, very good. Okay. So this becomes a great knee exercise, actually. Even though you're emphasizing hip a lot, okay, you're emphasizing the hip where you're bending from, you'll feel your quads work quite a bit.
Oh, yeah.
As well as ankle muscles and the hamstrings, but especially the quads.
Yeah, same thing when if I do a lunge, I try to do do it the same way and then try to keep that knee behind the foot,
Yes.
front foot, right?
Yeah,
And,
both knees.
well, you can't do the back knee.
Yes, you can. You should. I'm glad you only have 2 knees to keep track of.
Well, no, but my back foot's way back.
Yeah, mine is too.
So the knee is, it's tracked like straight this way, but it's in front of the knee, in front of the foot.
Well, here's my suggestion for you, okay, is keep track of both alignments at the same time. Yeah, of course, the one that really will tend to have a problem is when you put all your weight into the forward foot, but the trailing leg also deserves to be aligned, making sure that it's properly aligned even as you get down and get up.
Okay, here we go. Yeah, these pants are not good. Okay.
Okay. Yep, keep the alignment. You notice it wants to roll in. Let the trailing knee bend to lower you down.
And then push up and back, right?
Well, somewhat. You're actually keeping your weight more to the front of the foot. So if you take a look at me, okay, you take a look at me.
Yeah.
And then I'm keeping my weight over and forward over this forward foot.
Yeah, I see that.
Yeah. Huh? As if I'm tying my shoe and the people I'm with are still walking and I want you like, hey, wait for me. Yeah. So my weight goes forward and up. So I go forward and up, making sure my knee doesn't go forward to do that, and making sure that my knee doesn't roll in to do that.
Oh, I see. Yeah, it just rolled in. Yeah, I'll keep an eye on that.
Good. It's a very, very important point. It can be very subtle, but however, the payoff can be very big.
Okay.
Okay?
Mm-hmm.
Yeah. So this is something that I pay attention to all the time, because I used to get knee pain, because that's what I used to do. I used to stand like this.
Yeah, my knees are generally okay, considering how much running I've done. My knees are pretty good. Every once in a while, I'll get a pain in the knee, but I always thought it would have to do with the fact that my hips were tight or my glutes were tight.
Here's the kicker for you, okay? Because in order for you to exercise your knee nicely through activities through the day, which is what I'm advocating,
right,
you actually have to emphasize the hip, right? You actually have to emphasize the hip moving. Yeah. And so this is really good for the hip. It keeps the hip moving.
Mm-hmm.
It keeps the hip moving because when you emphasize the knee staying with the foot to maintain the weight-bearing line, you actually move from, guess where? The hip.
Mm. Okay.
Yeah. So this is very good for the hip too, to think in terms of this, of the weight-bearing line. Actually, it's the hip that saves the knee.
Yeah, that's a lot of times I'll roll out the hip just because to help the knee.
Correct.
Roll out the hip or the IT band sometimes too.
Yes, because the IT band gets tight in this alignment. The IT band is kind of like a bowstring, and this is the bow. And the more the bow is curved, the more the IT band will tighten to compensate for the bowing.
Yeah.
Versus here, the IT band actually has to stretch out and actually has to lengthen out to adapt to this alignment. Huh?
Mm-hmm.
Shortened, lengthened, IT band lengthened. Yeah. And so your ability to gain and maintain this form, this weight-bearing alignment, creates the foundation for a lot of exercise, not just for the knee, but also for the ankle and foot and the hip. Because if your knee wobbles inward, it undermines even your spine. Whoop, see? Keep that knee pressed out. It wanted to roll in, yeah? And then hinge from the hip. Lean forward from the hip more. That'll minimize your knee going forward.
Again, switch.
Yeah. You'll notice that if you try and keep your torso weight above, straight up, in order for you to do this, your knee has to go forward to balance over the supporting foot, right?
Yeah, well,
your knee goes forward. But if you hinge from the hip, your weight still goes over the foot, but there's no need for the knee to compensate, and it can stay over the foot, which is a point that you made that you want to be aware of, yeah? Yeah.
I'm not always good at it, but I try.
Yeah. Notice the way I'm getting up.
Yeah.
I'm upright. I start off upright, and then I'm going to get up. Get my weight over the forward foot, so that the knee doesn't have to push forward. So now I go up and forward.
Well.
Huh?
All right. I thought it would be up and backwards to keep.
Yeah, I noticed you're doing that. You're doing this.
Yeah.
Yeah. Even better, you want to do it this way. That's more functional. That's as if you're being athletic, right?
Mm.
To go up and forward. Right?
Forward with
the back. You're getting back, straightening up like that. That is a way of getting up. That is a method of getting up. But, however, it doesn't allow you to move very well. Versus, there we go. Yeah?
Yeah, yours is more functional. Mine's probably better strength exercises, I guess.
More functional. Very good. Yes. So try it this way, okay? Mm-hmm. And you can work progressively into it, okay? You could actually be close. You can have a chair close by, so that you can practice. You can practice. Notice the way I'm doing it. You can practice bringing your weight over, so that you can stand up and bring the trailing leg forward. Then you can have a chair to help you progress into it. Ideally, once you reach your full progression, you don't need the chair, and you just go down, and then you go up.
Okay, thank you.
Yeah. Now, this would be the last in the series, and thank you for tuning in, and I hope you got something out of it.
No, I did. Thank
Do
you.
it.
It's always, these are all good tips.
Thank you. This is what we do at N3PT. We pay attention to form, and form, then the exercise follows. Strengthening follows, function follows the form, okay? And so I gave you a big taste of that, especially in relationship to the knee.
Thank you.
This is the last of our video series. If you want to continue with a full body workout, there is Raul still giving full body workouts. I'm not sure when.
I think Friday.
On Mondays.
Mondays rather.
Yeah, and that'll be the only video that will continue.
Okay.
We're becoming more and more involved with patient care, and it's becoming harder and harder for the staff like me to keep up with this.
All right. Well, thank you very much. This was helpful. Thank you so much.
Very good. Bye-bye.
Bye.